Good afternoon, everyone. I'm Mark Claster, co-managing partner at Karl Marx Advisors and immediate past chairman of the Board of Trustees of Northwell Health. Welcome, and thank you for joining us. We're excited to have Michael Dowling join us today. Michael is the CEO and president of Northwell Health, the largest healthcare provider and private employer in New York State. Michael is a national thought leader, as evidenced by 12 consecutive years on Modern Healthcare's list of the 100 most powerful people in healthcare. In addition to his background in healthcare and healthcare management, Michael also has a keen understanding of the government and regulatory environment, having served for 7 years as Director of Health, Education, and Human Services and Deputy Secretary to the then Governor of the State of New York, Mario Cuomo. He was also Commissioner of the Department of Social Services. Michael Dowling has been introduced countless times over the years as a leader, innovator, healthcare progressive, and much more. But today, I'm introducing him as my friend. I first met Michael when serving as a trustee for Northwell Health. I was quickly drawn to his progressive mindset. He was full of ideas on how we could advance the health system into one that not only cares for people, but also for communities. And that's what we did. I had the luxury of working directly with Michael, serving as chair of Northwell's Board of Trustees for 5 years, which are some of the more transformational years in the health system's history. We rebranded, we expanded, we provided medical and community education, but most importantly, we kept Michael's promise to fulfill a vision focused on individuals, families, and communities. What continues to distinguish Michael, apart from other leaders, is his heart and soul. He genuinely cares for those around him and will do what he can to make their lives better. Today, Northwell provides quality care to more than 2 million people annually through a network of 23 hospitals and nearly 800 outpatient facilities, including 220 primary care practices, 52 urgent care centers, plus home care, rehabilitation, and end-of-life programs. Michael has led Northwell and its 75,000 employees on an extraordinary journey to success during an unprecedented time, COVID-19. New York was the epicenter of this disease, and Northwell, under Michael's leadership, was the epicenter in the fight against COVID-19. Northwell has now treated more COVID patients than any other provider in the country. The health system survived heavy patient surges, but thanks to Michael's leadership, Northwell adapted to moving targets in real time. And this might not have been achievable if not for Northwell's collaborative and innovative culture. And as Michael says, leadership is about being visible, about being together. So despite the stress Northwell went through, Michael embedded himself in the situation, walking the intensive care units alongside frontline caregivers who were the sickest of the patients. That is the epitome of a true leader. Michael's voice continues to resonate throughout the country. He documented everything Northwell experienced this spring in his new book, Leading Through a Pandemic. And he's here with us today to discuss this experience. Michael will speak to us for about 30 minutes or so, and will then take questions for the balance of the hour. So please submit your questions in the questions pane, and we will get to as many as we can. So please join me, without further ado, in welcoming Northwell's President and CEO, Michael Dowling. Michael?
Thank you, Mark. Thank you for those wonderful words and introduction. And again, let me say it's been a pleasure working with you and working under your leadership as chairman. And I just want to personally thank you for everything that you have been doing as a chairman and also as a friend. So thank you again, and I'm delighted to be here. What I will do is give you a little bit of an overview. Obviously, going through this issue can be extraordinary in its detail, and I'll try to avoid that and touch some key points. So let me make a few introductory comments and then talk a little bit about the book and some of the lessons learned and our experience. In general, let me start by saying that this year has been a year that I don't think any of us will forget too quickly. I think it's going to be imprinted in our memory forever, the year 2020. We've gone through a pretty extraordinary experience. And I would say it's not just only the experience for those of us in healthcare, because what COVID has done, it has changed the environment of absolutely everybody, every business, every individual, every family. So absolutely everybody has been impacted, not just only healthcare. We've seen during this experience, we've seen the best of people. And in some cases, we've seen the worst of people. We've seen the best of leadership in this experience, and we've seen the worst of leadership. This experience also exposed our strengths as a country, and it also exposed our weaknesses as a society. And we're going to be in this for quite a while. I don't think we will be out of this at all, at least until the end of next year. It will come and go. We'll have upticks and flat periods. It will ease off and come back a little bit. So I think we'll be experiencing a wave like this for the next 12 months or so. And of course, as everybody that's listening in knows, that the medical part of this is one thing, but the economic impact of all of this is another thing. So the economic impact of COVID is going to go on for, in my view, 5 to 10 years. I don't need to go into that in any great detail because I think you understand. The book that I will reference, we did not start out to write a book. I started out making notes every weekend about our experiences during the first month or two of the COVID crisis. And then I had people say to me, well, it would be interesting if somebody just documented what went on and what we experienced. And we started to do it. So on the weekends, I would write, and it ended up turning into the book, Leading Through a Pandemic, which I think is the only one that is out there that actually outlines the experience of a provider during the actual situation of dealing with COVID from the very beginning. So let me start by giving you a little bit of the history of COVID with us at Northwell. We started preparing for this in January, and I'll come back to that point later. We put together our emergency management infrastructure, as I said, in January. We did not get our first case, however, until the beginning of March 5th. We had cases in New Rochelle before that, which we worked with the governor on in setting up the testing sites in New Rochelle in February. In March, we had our first case on the 5th. It moved slowly. Remember, on St. Patrick's Day, we had about 75 cases. Didn't seem like a lot. The numbers were moving slowly. But then what happens, and this is something that, it's a lesson, of course, is it happened unbelievably quickly. By April 6th, we had in our hospitals 3,500 hospitalized patients. Unbelievably sick, in dire circumstance, many of them, large numbers in the ICU, large numbers on vents. That number of about 3,500 lasted for a while. Then, a week or 2 weeks later, it started to decrease, and it gradually decreased. So where we are is that we have right now in the health system, as of this morning, about 106 patients. We've seen a little uptick in the last week, and this has been in the press, so you're well aware of this. We're watching it very, very closely, because even though the numbers creep up slowly, we're always aware that it can happen quickly like it did before. So we have to be not complacent, and this is something that one of the lessons with this is that you don't get complacent when things look good, because it can actually come back, surprise you, and hit you very, very hard, very, very, very quickly. During the course up to this point, we have seen at Northwell in excess of 85,000 COVID patients. We believe the number is well above 100,000, probably 120,000, because of the first couple of weeks, we had no testing. We couldn't test. And so we weren't able to verify that they were COVID or not back then. So I believe we've probably seen about 125, 130,000 COVID patients in total. There's nobody in the United States that has seen that many COVID patients. Right now, as I said, we have 106 patients. We're in the process of recovery. We're bringing back all of the business that we had to shut down back in March. So most of our business was shut down because we needed the staff and we needed the space, etc. And pretty much for 2 months, almost 3 months, everything was just all COVID. Very little else happened in the hospitals other than COVID. We did do emergency surgeries that were absolutely necessary to do. If they weren't done, the patient would have had some consequences. So we did that. And we're now obviously have plans in place in case this comes back in any major way over the next couple of months. We have detailed plans in place as to how to deal with it. So we're confident in the capacities and the capabilities that we've got. So let me go to some of the lessons. And some of these lessons, by the way, apply to not only healthcare organizations, but I believe that they apply to every organization and every business. And I'll enumerate probably a dozen of them quickly. I can't go into excruciating detail on each one because obviously we don't have enough time. And during the Q&A at the end, if anybody has any specific questions on any part of it, I'd be more than delighted, obviously, to respond. So let me start with lesson number one, and that is that every organization should have an emergency management capability that is in place so that you can actually respond quickly to any kind of crisis that evolves and that happens. You know, because bad things do happen, and you have to have a culture of preparedness in your organization. And so with us, for example, we started building our emergency management infrastructure prior to 9/11 because we believed here at Northwell, given our location next to the airports near New York City, that in all likelihood, we were going to get hit with something that was large. We didn't know what it was. We didn't anticipate at the time 9/11, but we got hit with 9/11. And then in subsequent years, we had Hurricane Sandy, Hurricane Irene, we had SARS, we had H1N1, etc. So we had a whole series of crises where we already had put in place a emergency management infrastructure. What I mean by that is that we had all the right people in place. We had the structure where we knew what everybody was supposed to do if a crisis occurred. We had metrics and dashboards already put in place. And when I referenced at the very beginning that in early January, we got our emergency management team together. So we just put together those people that have been around for a long time in the structure that we've already had for a long time in anticipation and in preparation for the potential of the COVID crisis much later because we anticipated it would happen. This to me has to be a competency in every organization, whether you're healthcare or not. Healthcare, of course, in these kinds of situations is at the epicenter of everything, and it's very important there. But I think it's a lesson for every organization. A second major lesson here is that if you're an organization with multiple components, multiple parts like we are, we have academic centers, research centers, ambulatory facilities, inpatient, home care, we've got everything. The key is that all of those parts of your organization have to be working together in synergy. That has to be seamless integration between all parts. That became unbelievably important during the COVID situation with us, because at the beginning, the epicenter of the crisis was in Queens, where we have a number of our hospitals. It hit very, very hard. Many of you have been familiar with the situation that was highlighted in the press with Elmhurst. We have a hospital nearby. We got hit just like Elmhurst, but we didn't have the effect that Elmhurst had. We were able to respond to it, and the question was why? We were able to respond to it because we did such a thing we call load balancing. So we have a big emergency management transport system. We have about 100 ambulances on the road. So when those hospitals in Queens, like when Franklin Hospital in Southwest Nassau and Forest Hills got hit hard, like Elmhurst, we actually moved patients from those places, those two hospitals, to other hospitals that didn't have that many patients at the time. We actually moved patients from Queens to as far east as Mather in Port Jeff, as far north as Mount Kisco, where we have a hospital. We moved actually out of Queens during that period of time almost 800 patients, and they were transported. And all of this was done seamlessly. The point I want to make is that if the different parts of the organization were not working in tandem with one another, and you didn't have the teamwork and the collaboration and the trust, you would never have been able to move patients like this. So some of our hospitals, if we had not been able to do this, some of our hospitals would have been completely overwhelmed, and we would have an Elmhurst situation. Elmhurst did not do this. They could have moved some of those patients into some other hospitals in the city, owned by the city, but they didn't do it. And that's a lesson. The concept of systemness is important. The other thing we were able to do is we were able to shut down a lot of our businesses because we needed the staff. So we closed a lot of our ambulatory sites. We closed them, elective surgery, because we needed that staff to redeploy to other places in the health system where we had real upsurge of COVID. For example, at North Shore Hospital, at one point, we had about 800 COVID patients in North Shore alone. Most were in the ICUs, intensive care units. And so you needed the staff with the skills to be able to deal with that on an ongoing basis. So that idea of, if you have an organization with multiple parts, all the parts have to be working together. It's like a jigsaw puzzle. They've all been to be interconnected in a seamless way. Silos don't work, especially in a crisis. If you're siloed, you're in dire circumstances in a crisis if you have siloed mentality. The other thing is that for us, what the most important thing was the supply chain. You read an awful lot about this and heard about it in the media. Do we have enough masks? Do we have enough masks? Do we have gloves, gowns, shields, etc.? As you know, most of our supplies came from China. Now, we've benefited a little bit because over the years, we have created a major supply chain infrastructure inside Northwell. We have very talented people. We have our own warehouse. We have our own transport network with regard to this. So we had an inventory of masks and gloves, etc. But we still almost got into some difficulty, although it never really happened, because all of the supply came from China. And then that was shut off. So now we had to find other ways to get supplies from other places. And a lesson here, by the way, another small lesson in this regard is that your relationship and your trusting relationship with vendors is absolutely key, because in a crisis, trust matters. So our relationship with vendors was so key that they were able to do things, and they were willing to do things for us that they would not have done probably for others and didn't do for others, because that trusting relationship was not there between vendors and the provider. We ended up never having a problem of running out of masks, gloves, etc. Other places had this problem big time. And I worked with all of the other health systems during this period. I worked with the governor closely. So we were helping a lot of other health systems in the region, but we ourselves never came close. But let me give you a statistic. On masks, we were using, during the height of the crisis, 150,000 masks a day. So when people say, do you have enough masks? You have a large inventory. And if somebody said to you, well, I have 1 million masks. Well, if you're using 150,000 a day, that doesn't last too long. So we had to have a massive inventory, and we had to continue replenishing it all the time. And so the equipment issues that are important here, and one of the big lessons, of course, is that we were not making any of these necessary supplies in the United States in any big way. It was all overseas. So one of the lessons here is we have to do an awful lot of domestic manufacturing in the future, because as I look at it, we were fighting a war against the virus, yet the munitions that we needed to fight the war were made overseas, and we were dependent upon getting them from overseas. We were not making them here. We have to start making these things here, upgrade our stockpiles, and that's the other issue. There is a federal stockpile and a state stockpile. Yet both stockpiles had inventory in them, some of it out of date, some of it not complete. People didn't even know what was in the stockpile. We got stuff from the federal stockpile like vents, and vents became crucial because any bed can become an ICU bed if you have a vent. And we were okay with having enough vents during the period. even though it became tight at times, and we had to make our own vents and convert other machines to become vents. But back to my point about the stockpile, we got vents out of the stockpile that when we open up the cartons and the boxes, there is tubing that's supposed to come with them. There was no tubing. Our guys, very innovative, went to Home Depot, bought garden hoses, and then remade the tubing for the vents so we could use them to treat patients. Those kinds of things should never happen, and there's a lesson here regarding that in the future. The other big lesson, which I think is pretty self-explanatory and pretty self-obvious, but the degree to which you've got to do it in a crisis is larger than anything before. And that is the need to take exceptional care of your staff. So let me emphasize this for a little bit. Everybody was complaining about, do we have enough beds? You can always create beds. That was not the big issue, even though it got an awful lot of press. We can create beds. We created beds every place. We created beds in conference centers, in waiting rooms, in lobbies. We had outside tents. You can create beds. You can create beds. Can you create enough ICU beds? If you have the vents, you can create ICU beds. That's manageable. The thing that is the most complicated and the most difficult in all of this is the staff. Staff safety, staff morale, staff competence, staff quality, etc. We were the first in the whole area to require all our staff to wear masks. Back at the very beginning, the staff did not wear masks. We were criticized by other health systems when we required everybody to wear masks, and we were comfortable requiring that because we had the inventory, and we had hundreds of employees getting sick at the beginning. Once we put the masks on, it almost went to zero. Lesson here, and it's a lesson I wish everybody would listen to, including our national leadership: masks work. Right now, one of the safest places to be, by the way, is in a hospital, because everybody follows the procedures. Everybody knows how to mask, everybody knows how to wash their hands, etc., etc. And we have hardly any infection transmission inside our facilities at the moment. So with staff, we set up tranquility tents. We provided a lot of psychological help, daycare help. We provided housing for staff that wanted to stay in a hotel rather than going home because they were worried about their families. They were worried about their kids. They were worried about in-laws that live with them. That became, over all of it, the most complicated issue, and I can go into it in more detail later. The other big lesson here, especially for healthcare, is that we had to create a clinical team of all of the various disciplines that would meet daily on an ongoing basis, because at the beginning we didn't know much about the disease. As time went on, we learned more about it, about how to deal with it, so we're better off today than we were at the beginning. But that required, on an ongoing basis, new protocols, new standards, new quality alerts, new information that had to continuously go to staff all the time. We had to analyze new situations in the ICU, figure out, when do you give oxygen? When do you put somebody on a vent? When do you put somebody in the ICU? What are the treatment modalities? That became a major central part of the operation on a daily basis. Here in our organization, at the very beginning, we met in our command center. We met in person for the first couple of meetings, and then two of our senior leaders got sick, quite sick, in fact. They both survived, so we had to go virtual. So all of our interaction after the first couple of weeks was all virtual through Zooms and Microsoft Teams. None of us were together. I was in the office all alone. None of my staff were here, but we were communicating together, sharing our dashboard and metrics 3 times a day, in the morning, midday, and in the afternoon. Constant information flow. And that was a complete adaptable scenario that we had to learn how to work through, and which we did very, very successfully. I'll go through a couple of other quick things. The governor and governor worked closely. I worked for him, put it this way. I worked very closely with the governor during all of this. He held many of his press conferences at Northwell. I was on the phone with him almost on a daily basis. We're helping him coordinate all of the other systems. I worked every 3 days a week. I would have meetings with Columbia Prince, Sinai, NYU, Montefiore, and others, coordinating our activities, sharing information, etc. We opened up Javits, and we ran the Javits Center. After it was a disaster at the beginning, we took it over, Northwell did. We ran the Javits Center. We also coordinated the big ship that came in. That's another whole story, which I can go into if anybody has a question on this. But one of the things the governor did at the very beginning was he dispensed with most regulations that we are currently, that we always work under. And when you get rid of a lot of regulations, you can become unbelievably flexible and adaptable. So, and now we're looking to see which regulations that were dispensed with that we may not need to continue anymore. And the other lesson here is that the speed of innovation and creativity is extraordinary in a crisis like this. We did things overnight during the height of this crisis that would in normal times have taken us 2 to 3 months to do. So I remember sitting here, you know, in our command center, which was virtual, as I said, and we were deciding that we had to create 200 new beds by tomorrow morning because of the volume of patients coming. Overnight, we created 200 beds. We had to deploy hundreds of staff within a day. We did it. We ran out of swabs for testing at the beginning. We actually ended up making our own swabs. When vents became a problem, we took what's known as BiPAP machines and we converted them and turned them into vents. And we shared all that information with everybody else in the region. So it's amazing how innovative you become. No surprise, of course, because even during wartime and other major crises, it's amazing the discoveries that occur and emanate from crises. But it became very, very obvious during this situation. And one of the things we're trying now as we go forward is trying to figure out how do we maintain that same level of innovation going forward that we had during the COVID crisis. Telemedicine. We had a big telemedicine program here before COVID. But when we had to shut down a lot of our activities, the only option that a lot of people had to take care of what needed to be taken care of, including patient care, was through telemedicine. So there was a massive explosion in telemedicine and virtual care. And as I've said to many people, the genie is out of the bottle. We are going to be expanding telemedicine in a big way going forward because people understood that during the crisis here, it worked. And a lot of naysayers, the people who didn't necessarily agree that it would work, became converts. And so that will become a big issue going forward. And it's one of the things that will become part of the new normal, which I'll comment on later. Another issue that is extremely important here is communication. In a crisis, you cannot over communicate. You have to do it consistently all the time. So we used every medium we possibly could to communicate. It was consistent because the staff need to know that you care about them, obviously. The staff needed to know that they were safe. The worry of staff was, because they read all of the stuff, of course, in the newspapers, is, are you going to run out of supplies? We were able to tell them on an ongoing continuous basis we were never going to run out of supplies, that they were going to be safe. And as Mark mentioned at the beginning, I walked the ICU of every hospital at the height of the crisis because it's important to be out there with your staff. You can't stay in your office. There were some CEOs left the city altogether. Some CEOs stayed in their office and delegated. I didn't believe that was the right way to do it. So I and other of our leadership walked the floors, met with the staff, talked to the staff. I have some extraordinary stories with regard to this. I'll just mention one. At this point, being in one of the hospitals, when a nurse comes out of the room, looked a little bit distressed, I went and talked to the nurse on the floor of the ICU. And the nurse was, as I said, a bit depressed. I asked what was happening. And she just informed me that her mother had just died in that room. And I encouraged her to take a little break. And she actually said, no, I am going to continue working. I'm staying with my staff. This is my job. There's not I can do right now anyway. And this happened to me a number of times. Another situation where I was with a staff person, a male nurse, and his father had died in the floor below in the hospital at the same time. So when you come across those examples and you see what goes on, the appreciation that you get for the courage and the compassion and the dedication of that staff is extraordinary. It actually is humbling to be in the presence. And whenever people had asked me, wasn't it hard during the crisis? My answer is no, not for me. The people on the front lines, those are the people that had the bulk of the pressure on them. So communication. Mention about just a couple of other things. The budget. One of the things that you have to do in a crisis like this, and something that we said and talked about right at the very beginning, forget the budget. The budget goes out the window in a crisis like this. You can't be making decisions based upon what the financial implication is, because if you do it, you will not serve the public well. You know you're going to take a hit. You know you're going to take a loss. You know your revenue is going to get hit in a big way. We had a huge revenue loss in the billions of dollars, almost $1.8 billion. But you can't let that drive you during a crisis like this. You deal with what you have to deal with. You take care of the public the way you have to take care of the public. You take care of your staff. We spend about $350 million in extra expense because we had to retrofit the hospitals. We had to create negative air supply in many of the floors. We had to provide extra support for the staff, etc. So we spent expense-wise about $350 million extra. My attitude was, do it, don't worry about it. We'll figure this out later, which is what we're now doing. So some people, and I know this occurred in some places that got themselves in trouble, that they didn't want to invest because they're worried about the budget. Get the budget during a crisis like this. An issue that came very, very obvious during the crisis was the disproportionate effect COVID had on certain communities. The Black community, Hispanic community, the minority communities were disproportionately affected by COVID. That information is all over the place. You know, you've been reading about this. That now creates, we've known some of this before, but now we know in a big way that this is a crisis situation. So the question now is, what are we going to do about those communities going forward? How do we relate to those communities? How do we provide more services to them? How do we provide access to care and improve their health status so that they're not in this situation if this happens again, which, by the way, I believe it will. So the whole inequity issue was one of that underbelly issues in healthcare that we've known about. It became very, very obvious, however, during the situation here. And we also work with other health systems across the country. Partnerships matter here. In the middle of the crisis, I called the CEO of Intermountain Health, which is a huge health system in Utah. And I called and I said, if you have extra staff that you can spare, we could use them here. They sent me almost 100 employees from Utah. I also got employees from Rochester, Strong Memorial Health System in Rochester. So what we've done now is we have developed reciprocal relationships with 5 or 6 big health systems around the country. So in the future, when they have a problem, we help them. We have a problem, they help us. And with Intermountain in Utah, after they helped us over the last month and a half now, we've sent over 30 staff out to Utah to help them. We also send staff to Houston. We send staff to Savannah, Georgia, because in a situation like this, as I said, you don't worry about the budget, you just do it. It's the right thing to do. And the last point I'll make here before a couple of concluding comments is that leadership matters. In the state, I think we were very fortunate. New York has handled this quite well. Not everything went perfectly, of course, but we handled it quite well. I don't want to get partisan here, but I mean, the governor did, my view, a wonderful job. He was on the ball all the time. I mean, every single day, I was talking to him, and he was involved in every single thing statewide. And so we had, pretty good state leadership. The federal government was during most of this, I can frankly say, pretty much disastrous and not necessarily helpful. And we are seeing some of the results of that now. Leadership during these kinds of situations is about unifying, having a common purpose, understanding the needs of the broader community, bringing people together, taking accountability, etc. That's what you do in a crisis. It's what you're doing all the time if you have leadership, if you have leadership responsibility. And the lessons now going forward for the United States is we are going to have another pandemic. It's going to happen. It may not be as bad as this, but it could be worse. It's inevitable. We all know. We got to start preparing now for what we need to do going forward. And that requires some global leadership as well. I can talk a little bit about that during Q&A. And lastly, going through a situation like this, I believe, has changed us all. We're different people because of it. It has changed our perspective, gets us to think differently about things, about family, about friends, about community, about social relationships, about the things we took for granted that we now just not know we can't do because of this. And I frankly think that we're better for it. Ever so often you have to be humbled, and your fragility has to be exposed ever so often for you to realize that you can become a better person and a better organization. So we're coming back. We have to build a new normal. And I think we will build a better organization going forward and be a better place because of the experience that we just went through. We can say that we lived through a pandemic. Nobody else that's alive I can say that they've lived through a pandemic. We're living through it. It's not over, and it won't be over for quite a while. But I think we're over the worst part of it. And I think we did quite well. And if you have the book and you read the book, I think it'll give you a more in-depth analysis than the one I just gave here. But I've been privileged to lead this organization and privileged to work with extraordinary people at the front lines who did extraordinary work. I cannot say enough about what the nurses and the social workers and the respiratory therapists and the security guards and the environmental workers and the physicians all did in cooperation with one another, in tandem with one another. That was the key. So Mark, let me stop here. I've given a lot of information, but I think I stop at this point and then open for questions. I know people may want to talk a little bit about the vaccine and other things going forward, though. So let me stop here at this point.
Thank you, Michael. Yes, there are a number of questions that have come in. So let's start with a thank you. First and foremost, thank you and the people of Northwell Health for the care, compassion, and courage exhibited during the crisis. My question is rooted in concerns for the healthcare system if a second wave were to occur. If Northwell were to have the same knowledge in treating COVID-19 patients at the onset of the pandemic in New York as it does today, would have made a significant difference in managing patient outcomes, PPE shortage besides. Why? And what was learned in wave one that would have substantive impact in treating surge patients if a second wave were to occur?
Well, first of all, we knew very little about the disease at the beginning. This was a big issue. We didn't know exactly what this was. We didn't understand that. We thought at the beginning that it only affected the lungs. We quickly found out within a week or two or three that it affected the heart and the liver and the brain. It caused blood clots. So I'm not obviously a clinician, but I was sitting in on the meetings and remember the changes that we had to make. So today we're much more knowledgeable about the disease. We have more treatments today, more combinations of treatments. We were actually doing, I forgot to mention this, we were doing a lot of research treatment trials during COVID. So we know an awful lot more today. The other issue on supplies. So the answer to that point is that yes, we would be able to take care of patients better in the future. We have another upsurge, I believe. Secondly is on supplies. We were relatively okay, but the broader lesson is that we have to produce these things domestically. We at Northwell right now are thinking about working with another partner, other companies to actually manufacture our own PPE ourselves or be in partnership with somebody that does it, so that we're not dependent upon a place in Wuhan, which is where these supply companies were. But we diversify our supply chain. That's a real lesson that going forward, I think we would be in much, much better shape. Staffing, we learned, for example, that we were deploying a lot of staff all over the place. We didn't exactly know the detailed competence of every staff as to whether or not they had the ability to work in an ICU. We're working through that now to develop that repository of information. So going forward, we would be in much better shape. Right now, we do have plans in place assuming we will get 5,000 new COVID patients in our hospitals over the next couple of months. I don't think it's going to happen, but we have plans for that. And we have also plans that if we had 5,000 patients and on the same weekend we had a hurricane, how would we handle it? We have very detailed, we do tabletop exercises all the time. We have detailed plans about how to do this. So going forward, I think we would be much better because of the learnings we got from the first experience. I think working with government also, we know how to deal with that a little bit better now than we did in the past as well. So everybody has got better, I think. We're just hoping that it doesn't come back like it had previously.
You mentioned clinical trials. Donald Trump's medication list included famotidine, and Northwell was doing a clinical trial on famotidine. Was there any relationship between the Northwell clinical trial and his taking it? Was there any consultation? And was there any results from the famotidine clinical trial?
No definitive results yet. There is, observational results. So we know that when certain patients took it, they got better, but it was not, we are in a trial, but we don't have the definitive results from the trial yet. There was no relationship, no connection between us and what Donald Trump took. There are people here, some of our clinicians believe that famotidine really works, that people should take it, and that it can actually potentially help prevent some incidents. But the other problem we had with some of these trials, Mark, as you're aware, is that after we get approval to do the trials, the numbers started to decrease. So when we had thousands of patients, we hadn't got permission to do some of the trials. When the numbers decreased, we got permission, but then we didn't have enough numbers to do the trials the way we would have wanted to do them. So now we're doing some trials in the ambulatory settings, etc. So, but there was no relationship between what we are doing and have done and what we've done at the White House. Now, Kevin Tracy was in contact, obviously, with the CDC and the FDA on these, and there is that, there's always those relationships that we have. I've been in contact with the head of the FDA, somebody I know pretty well, and Kevin obviously has a lot of the relationships with the CDC. So those discussions, obviously, were going on all the time, but nothing in relation to what Donald Trump went through in the last week or so.
Right. And just for the people on the phone, Kevin Tracy being the president of the Feinstein Institute for Medical Research, our research arm here at Northwell. You mentioned vaccines, so let's talk about that. How realistic is a COVID-19 vaccine by the end of 2020? Do you believe there's sound rationale for individual states, including New York, to be independently verifying the efficacy of a vaccine? And how will it be distributed?
Well, first of all, I do believe that there is the potential, and Dr. Fauci actually mentioned this yesterday, that there is a slight possibility that there could be a vaccine by the end of the year. I mean, a vaccine that has gone through an appropriate trial and verification and validation. I think it's going to be more in the beginning of next year, but it is possible. The key here, and I think this is important, is that you cannot short circuit the process of going through a trial and doing it properly. There is a whole process. It needs to be speeded up, but you can't skip the steps in the process. The White House has been trying to get the FDA to skip some of the steps. That would be very, very dangerous. You don't want to come out with something that has not gone through extreme validation by outside experts as well as internal experts in the FDA. And obviously the drug companies want to make sure that it is valid when it comes out anyway. So the public, I think, if there is not trust in the vaccine because they think it has been skipped, the process has been skipped in some way or another, or done for political reasons, people are not going to be trusting to take a vaccine. And that's going to be really problematic if and when something comes out. So I hope it is done the right way. It should be, science should dictate this. So let's assume it's done into the year, the beginning of the year. Then the question becomes who gets it. Now, let me step back aside a second. We in Northwell, we're working with the governor at the moment and the state in helping to put together the vaccine distribution plan for the state. I'm going to have people working directly with the State Department of Health on this, beginning, in fact, later this week. So the question then becomes, who gets the vaccine? The first people who will probably get it will be healthcare workers. Second group will probably be people in high-risk categories. The distribution of that takes time. We don't know yet, when you distribute the vaccine worldwide and you distribute it across the states, who gets what, how much will the state get? This governor has put together a vaccine advisory group that would go through all of the data to verify that the vaccine we're getting has gone through the right processes. Bruce Farber, one of our head of infectious disease in Northwell, is on that task force. It's only 6 or 7 people. So the general public, for most of the people listening in here, I don't think the vaccine will be available for them until the middle of next year, because you got to go through the process with the healthcare workers, the essential workers, the people high risk, et cetera, et cetera. It'll be distributed, by healthcare organizations, by local public health authorities. By the way, the vaccine, you probably, depending on which one comes out, you're going to have to get 2 shots, and that has to be between 21 and 28 days between 2 shots. You've got to have the massive data system to understand who gets it and who doesn't get it. The vaccines have to be in freezers with unbelievably cold temperatures. We have to make sure there's enough freezers all over the place, because once you take it out of the freezer, it only lasts for a couple of hours, 2 to 3 hours or so. And we have to make sure across the state there are enough freezers. That's the issue between what the state does and what the city does. This is quite complicated. We're going to be smack in the middle of it. But for the general public, the relatively quote-unquote healthy public, I don't think the vaccine will be available for distribution to those populations until the earliest late spring, probably later next year. And I think people have got to get comfortable with that thought.
Okay, sort of an inside baseball question. Since you were so close to Governor Cuomo, was there ever a time that he and you felt overwhelmed, fear, a potential sense of defeat? He showed great courage always on his news conferences, but behind the scenes, what was really going on?
During all of the situation for the last 8 months, I don't ever recall us getting to the point where we were, like stressed out and overwhelmed. I mean, I don't get stressed out that easily anyway, because I think it's very, very important to stay calm and not get overly excited. It's not a good trait in situations like this. There was no time when I believe, and as you mentioned, I was dealing with him a lot. There was a lot of confidence, optimism about that we can handle this. Right now, I think there is a little bit of stress because of what the community out there is doing in general, about the inability of people to continue to comply with masks wearing and social distancing when appropriate, and the frustration about how do you get people to do this? Because that's the prevention side of this. I know that frustrates him. I was on the phone with him over the weekend, and it's like, so the question becomes, like, if I have to create beds, I know how to create beds. If I have to take care of a patient, we know how to do it. But how do I get people to do things like wearing a mask out in public? And if they don't do it, what do you do? And I know these are the questions that are being asked, and this is why there's this debate at the moment about shutting down schools in some areas and maybe shutting down some communities. Because we know, by the way, with our surveillance systems, we know by zip code where the high risk cases are, and we know we track this on a daily basis. So I'd say there's a little bit more stress today about how to get the public to comply than there was during the height of the crisis about how to getting us to take care of the patients. But it's a different situation. So I think that's going to be the worry now for the next couple of months. And if we don't comply, then you're going to have an uptick in cases.
Okay. You talked a little bit about telehealth. The question is, what is your vision for the future of growth in the home health sector as an integral part of the healthcare continuum?
Well, home care has been huge all during the crisis. We used home care big time. And remember, if you have COVID and you were in the hospital and you survive it, that doesn't mean you're completely right. It means that many people still have long lingering issues. But home care is going to dramatically expand, and telemedicine is going to expand with it, and vice versa, because the more you can actually monitor people, the more that you can treat people remotely, gives us more options to take care of people. So technology in that field is going to dramatically expand. And I think it's going to be a big growth area. We're going to be expanding telemedicine big time. Home care is going to become a bigger and bigger part of the delivery system, because you can now do an awful lot in the home that you once could only do in the hospital, etc. So that's a growth area. We just got to make sure that we, all of the different technologies that are being put in play at the moment, that they can actually work together and that we can get the proper information from them. But yes, it's going to be a major growth area, and home care is going to be much bigger now going forward than it ever was before.
Okay, this is sort of a dual question going to patients and to the health systems. In general, the question is, have patients been covered when they're in the hospital during COVID for such a long time period, or are they getting big bills? And how can they afford to pay if that is the case? And then on the other side, how do you manage cash flow in this environment?
On the first question, during the height of the crisis, the federal government, extended Medicare coverage, and obviously, there are patients that don't have insurance, and we have to eat it. We take care of it. What the insurance companies will do now is, the insurance companies, I have to say, have not been helpful here at all. We asked the insurance companies for help, financial help and other help, including giving us some of the money that they owe us, and they refused. They have been absolutely a disaster during this whole crisis, not helpful. And now they're talking to us about maybe they won't pay for telemedicine the way they want to pay for it. Maybe they'll deny coverage that people were covered before, and they'll deny payment. That necessarily may not affect the patient, but it will affect us. I have had no complaint, and I've had 0 letters, by the way, about people during COVID getting large bills. It's interesting that question came up, because I often get letters about people getting, over deductibles and co-insurance and complaints. I have not got any of them during this crisis for the past 8 months. I'm jumping to the conclusion that we don't have a problem, but obviously subsequent to this, I'm going to check to see if something is happening that I don't know about, but it hasn't come to my table at all. So my quick answer is I don't see it. I can say that it's not happening in some instances, but it's not come up as a big issue.
Okay.
And the cash flow, we were able to manage quite well. We extended our line of credit, but we started to recover our business back. We started to bring business back at the end of May. So during March and April were the worst months for us. And then we started to open up business again in May. And now we're coming back. We're almost back to 100% of where we were pre-COVID. And so we were able to manage this. We will have a loss this year, obviously. We're going through the budget process right now. We don't know exactly what that number looks like. We did get federal help. We did get over $1 billion in federal support as a result of, people may be familiar with the CARES Act. We got that support. It didn't cover the whole nut, of course. And some of it, and we got an advance in Medicare, which we're supposed to pay back. That's in discussion with the feds right now as to what happens with that. So there was some assistance, which of course we lobbied for heavily. And since we were the place that, saw more COVID patients, we believe, than anybody else, we did get a substantial support from the federal government. But it does not at all cover the whole nut.
Okay, we have time for a couple more. So let me go with this one. Michael, given your comments on Northwell's success in mitigating the spread of COVID infections within your hospitals by proper procedures of mask wearing, hand washing, etc., is it feasible for other businesses to reopen, operate as normal if they were to follow similar procedures?
I think businesses can open if they follow appropriate procedures consistently all the time and do the screening when people come in. The danger, the question, of course, if everybody complied, it would make life an awful lot easier. But some people comply and other people won't. And you've got to comply outside the business. You know, when people leave the business, they've got to comply. So yes, if you check temperature when people come in, if you test your employees, if everybody always wears masks when they're together, if they social distance when appropriate, when they can't social distance, yes, I believe businesses can open. And that's why the governor has been opening up business. He's been doing it carefully and slowly, because what he didn't want to do is open, as happened in other states, and then open too quickly without those precautions in place and the commitment to comply in place, and then have to shut down again. That one thing he does not want to do, because it completely destroys trust. That's why he was very cautious the other day about not shutting down the businesses around the schools where we were having an issue. And of course, that's not over with yet, but he's very concerned about those businesses, and opening and shutting, I think it causes an economic disaster. But the answer to your question is yes. We're working with a lot of businesses on this. They're asking us for advice and support. We have a program called Northwell Direct that works with businesses, in part helping them with this issue. We're delighted to help people on it. But yes, but it has to be all the time. You can't do it for a week and then get relaxed. It has to be consistent.
And I think we'll conclude with this question. What are the most important lessons you learned about yourself as a person and as a leader from your experience during the pandemic?
That given what we were able to do during COVID, I'm always frustrated about why I can't do more. I mean, we've just gone through an extraordinary experience. We handled it well. And then you say to yourself, yeah, I did okay there. That was okay. But now, how do I raise the bar now? How do I continue to be even more innovative, more creative, more diligent? Each one of us has the potential to do much more than we think we can. COVID, eventually will be history, and we look back and say we did a great job. Hopefully, we'll always be able to say that. But the question now is, going forward, going forward is what matters. How do we actually get better at what we do? Learn the lessons of COVID to build a better organization. So in many ways, it's you get a little bit frustrated about your inability to do as much as you know you can do. So I just learned about myself that there's more there than I have mined yet. It's like being in a game. I played competitive sports, and it's like there's 10 minutes to go in the game, and you're dead tired. You just can't move. You're hurting. You've been hurt. And all of a sudden, the last 10 minutes, you get that extra win, and you say, no matter how hurt I am, no matter how tired I am, I'm going to find a win, and I'm going to be played better enough for the last 10 minutes than I did for the first 80. That's how I feel.
Well, Michael, as always, you provided great insight on a host of subjects with regard to this disease. We can't thank you enough for taking the time today and spending your day with us. It really was a wonderful hour. So thank you very much. And just to conclude, I'd also like to thank a few people who helped make this happen today. From Northwell, Laura Okrent and Renee Wunderluck, and from Karl Marx, Janine Kratiger. Thank you, all three of you ladies. We appreciate everything you've done. And to the rest of you, we do hope that you found this informational, insightful, inspiring. It was our pleasure to bring this to you today. And if anybody wants to see this going forward, this will have been taped and we will get it to you. All you have to do is contact us on this or any other questions that you may have. So with that, we'll say have a great afternoon, and most importantly, be healthy and stay safe. Thank you all very much.